Hi there everyone, it's Ryan Liberty, and in this video I'm going to talk about what to do when therapy is not working. I'm tired of not getting anywhere. Okay everyone, I hope that's not how you're feeling, that you're just so sick and tired of not getting anywhere. On this channel I talk about humanizing mental health and showing that mental health is something that we all deal with and we all have different human experiences around it. So don't worry if that is how you're feeling, that's okay. There's somebody else that feels the same way watching too. In this video we're going to talk about what to do when therapy isn't working, and it's kind of a continuation of my last video of why therapy is not working. So these are the things you can do when you're in those situations. So I've got notes down below, as I always do. The first thing I want to say is do not stop therapy just because it's not working. There are a lot of options here, so if you're feeling like it's not working, that is not a sign that you should stop therapy. That's just a sign that you should make some adjustments. So we're going to talk about those adjustments now. So we're going to start with what you specifically can do because you have the most control here. If you are feeling uncomfortable opening up to your therapist, if you're having a hard time just bearing the truth, being vulnerable, the first thing I would say is that tell the therapist that you're feeling uncomfortable. Tell them, I don't really trust you. I don't feel good around you. I'm not really sure how I'm feeling. It's really difficult for me to talk about these things, and let the therapist have that information. That doesn't mean you have to go ahead and talk about those things, but maybe that's a good sign for the therapist to evaluate what's going on and kind of give them a chance to modify what they're doing with you. Now, even if it's too hard to say that to the therapist, something that you could do is write it down on a piece of paper or ask them, maybe, can I email something to you? Just to get it so that you don't have to say it directly to them, because I know that's very difficult for some of you to even say that you're having a hard time. So consider that as an option, maybe writing it down, slipping it to them, saying, can you read this outside of session when I'm not present, because that's too overwhelming for me. Another thing that you can do is, if you have a homework, in the case of like DBT, dialectical behavior therapy, for example, there's a lot of homework given. Maybe say that you're just having difficulty doing the homework, you're finding it hard, maybe it's difficult to concentrate, maybe you have trouble answering the questions, whatever it is, bring it up, let them know, and maybe they can go over the homework with you in session. Let them at least have the opportunity to help you figure it out. Don't just show up with no homework done and let that become the norm, that you just don't do your homework, because you're never going to progress if you're not doing that homework, or at least finding an alternative to homework that's going to work. So bring it up, talk with your therapist about it. The next thing would be, if there's something in particular that bothers you about your therapist, let them know. I know that sounds kind of hard, and I know that's challenging. So maybe you do feel like you click with them, but whenever they say something like sweetie to you, that might feel inappropriate, and that may really trigger you, and they maybe don't know that. So let them know, I like you as a therapist, I feel good when I'm with you, but when you say this, it's really bothering me. Or maybe whenever they dig into a particular topic or an area that makes you uncomfortable, let them know that. Give them the chance to talk about it with you or modify the way that they do things. Don't just up and leave therapy or close off the possibility of this person being somebody that you can work with. And finally, when it comes to you, just give it some time. Sometimes people go into therapy, they do like 2 or 3 sessions, and they're like, no, this isn't for me, I don't like it. But 2 or 3 sessions is not usually enough time to really get a feel for a therapist and to get a feel for the therapy. It's kind of like an introductory period. So give the therapist some time to kind of like learn about you, give yourself some time to learn about the therapist, and really see if this is working for you. It's hard sometimes when we're just not feeling it, but you got to give it a little time. Sometimes people will surprise you. Let them do their thing. They're trained to do this. Give it enough time that they can at least try. And I'm not saying to hold on forever. If it doesn't feel right, of course, we'll talk about that a little bit later in the video. But allow them the chance at least. So those are things that you can do. Something else you want to look into is medication. Maybe consider getting on medication if you're not already on medication. That will definitely help in some instances where things become a little too overwhelming, or maybe you shut down. Something else to do is talk about with your psychiatrist, how does the medication make you feel? If you find that you've been on medication a while and it's something that you've gone through the proper onboarding time, that it's adjusted and you're on it now and you're just not feeling right on it, it doesn't feel good, talk about that and see if there are other avenues to explore when it comes to medication. And of course, allow time for those adjustments to occur, because when you're getting on a medication, getting off of a medication, or kind of adjusting between two medications, there are periods of possibly withdrawal, there's periods of side effects and things going on. You're going to feel a little strange sometimes, so allow that to ride out, give it some time. Now, when it comes to your therapist, there are things that your therapist can do, and you can kind of nudge them in the right direction here. So mention to your therapist, you know what, I don't feel like I'm seeing a lot of progress here. And two things may happen. So the first thing is, if you're telling your therapist, you know what, I don't really think I'm seeing a lot of progress, I don't feel like I'm getting anywhere, that gives them the opportunity to maybe show you where there is progress. Because sometimes when we look at things ourselves, it's hard for us to see how much we've changed, and they may be able to say, like, remember like the first time you came in here and you said you were having all these problems with this particular topic, and we're not even talking about that topic anymore because we moved on to something different because you've resolved that topic. That might be an example of progress that you're maybe not seeing because you're still thinking that you should be like 100% better. And so you don't even realize, like, oh, you really did progress from that one thing to something else. Now, the other thing that a therapist can do also is to reevaluate and to say, you know what, maybe it's not progressing, or maybe we should be trying something different. So you give them the opportunity by telling them, I don't feel like I'm progressing. I don't feel like this is really getting anywhere. You're giving them the opportunity to re-examine things and see if maybe there's a better approach to take. Now that kind of leads into my next one, which is that see if there is a different approach to take. See if there's a different therapy that can be used. Maybe it's just that you've been doing the same therapy for a long time. It's getting a little tiring. You're getting a little bit maybe bored of it. I don't know. Maybe it just doesn't feel right for you. There could be another therapeutic technique that could be used, and you can discuss that with your therapist. You could say, you know, we've been doing this for a while now. It doesn't feel right for me. I'm not getting anywhere. It's frustrating for me, and let them have that discussion with you. At least give them the opportunity, and then you can make a decision from there about what to do. And the final thing is that if you do feel like after all these discussions and talking with your therapist that it's really just not working out, you're not clicking, they're not listening to you, they're not showing you progress that you feel like you should be doing, ask them for a referral to another therapist, and they should be able to give you a couple of different referrals to somebody that's maybe in a comparable price range. Maybe they take your insurance, maybe they work in the same field of expertise, but they can at least get you referred out to somebody else that maybe you will be able to click with a little bit better. Sometimes that's just a necessary step. We don't click with everybody, and it doesn't always work out. So those are a number of things that you can do when therapy is not working out. I want to hear from you though. Have you had an experience, I know I have, where a therapist hasn't really been working out for you, and what did you do in that situation? I'd love to hear, and I know the rest of the community would love to hear, so go ahead and leave that down below. And thank you for participating and helping me to humanize mental health today. Do you give a about mental health? If you do, then I've got some free coloring pages I think you'll enjoy. Go ahead and click to get those. If you like this video, I have many more on YouTube. Subscribe to see the rest of them. And if you have any questions or comments, please leave those down below for the rest of the community and share with a friend. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.